As more people get COVID-19 booster shots, we wanted to know if those additional shots will eventually lead to a change in how we define the term fully vaccinated. Here's KVUE's Mike Marute.
Wednesday, Austin-Travis County returned to stage 4 guidelines for COVID-19.
We've had high community transmission since the Christmas holiday break.
According to local and state data, Austin's positivity rate is at about 18%. The state's for PCR tests is at 24%. And in the days before and after Christmas, Austinites have been waiting in pretty long lines for testing and to get their vaccines or booster shots.
So depending on what you're trying to accomplish, really, I think defines whether or not you consider just having the 2-dose series without the booster protection being fully protected.
While some lines for booster shots wrap around parking lots, others extend just a few steps out the door.
I believe for individuals that protection really does include the booster recommendation. If we're looking at it from a proof of immunization, that's a different story and a little more complicated.
But access to both testing and vaccine resources has been an ongoing barrier for minority groups disproportionately affected by COVID-19.
Because we are on this new wave of Omicron and because everybody's rushing to go get a COVID test, we're seeing the same barriers that we saw almost 2 years ago when our people were trying to get access to testing.
And even with the holiday surge in demand, Dr. John Carlo and other health experts don't see these lines for testing or boosting getting much shorter anytime soon.
It's very likely that after the holidays, when we start seeing even more cases, that demand could go up even further.
Local health officials say for now, they won't change the definition of fully vaccinated to include needing a booster.
We don't anticipate a change at this point.
But redefining the term is part of the conversation.
We're all recommending and certainly feel that that's an important part of overall safety.
In Austin, I'm Mike Marute.